In this assignment I'll be talking about 4 different sports injury scenarios and how to deal with them. The first one I started off with was an open fracture to the tibia and fibula. Now this is a open fracture, therefore the bone is broken through the skin of the bone of the leg, and the injury can occur through, well, many sports, games, any sort of like falling over, getting hit on the leg or anything like that. An example I have was in 2010, I believe it was, Eduardo, the Arsenal football player, got his leg broken by Martin Taylor, and where his bone was poking through his ankle and it was not very nice to look at. Now, ways of dealing and treating with this injury is obviously call an ambulance straight away. So to keep the athlete warm, this is important so they don't like freeze or go into shock. Sole taps can be used by observing the bone being outside the skin. Obviously, wouldn't really need to ask where the pain was. You'd sort of see that. You can ask for any other injuries. Looking at the injury, you can see where the injury will be. Let the paramedics deal with the injury. Keep out of the way. Don't allow the person to move. Don't move the person. This is important so it doesn't make it worse. And basically you just keep them still and stop them from trying to move around. Now you can protect the person using price. You can protect the person by like clearing the area of any people, and then just don't really put ice or anything on it, and let the paramedics do that as it's their job. And because this is a really high serious injury. The next injury I've got here is a sprain to the ankle, and a sprain is where you stretch or tear the ligament to cause a sort of through trauma, knocking a joint, maybe getting injured in a game by landing on your foot incorrectly, landing on it sideways and spraining it. This usually happens with ankles, wrists and knees. An example of this is where I landed on the floor poorly, stretching the ligaments on the outside of my foot, overstretching them, causing it to swell up, and yeah, it's painful. You can use sole taps on price for this. Sole taps, you can see the injury, like how it occurred, by them landing incorrectly. You can ask where the pain is, so you don't physically touch right on the pain. You can go around the edges to check temperature and that. You can look at the injuries for any bleeding, swelling, anything occurred. You can touch to see temperature, tenderness of it, see if they can move on the and then allow it if they want to be moved and want the help. You can sort of slowly aid them to walking, maybe getting up. If the signs allow, then see if they're able to start to move a bit more on it, so stand on it, possibly walk on it, or if it's better than that, then possibly even start running or jogging on it. Price is used to protect the person when it's warm, because if they're on the floor then you don't want anyone crowding around and getting in the way, especially if it's really painful. You want to get rid of any objects that they could potentially walk into if they manage to get up. You want to use rest to allow them to rest the area. Obviously could be using a few days for this. Ice would be applied to stop swelling and stopping the blood flow from getting there, so it reduces the swelling. Compression, maybe use like a bandage to keep it compressed and not allow it to twist again and make it worse. Elevation stops swelling, breathing again, and just diagnosis to maybe you can diagnose them yourself if you're training off or get them examined at hospital, depending on how bad it is, or a doctor's. Definitely use a doctor's or a physio to look at this so they can help with movement and help with the reconstruction, if you can call it that, like aid in the recovery. My third injury is concussion. This is usually an injury to the head where it knocks the brain inside the head, banging against the skull. An example of this is where Mascherano collided with a player from Holland during one of the World Cup games. He went on the floor and couldn't move for a few seconds because he was knocked out, and obviously got substituted. You can use salt taps for this again to see the injury, like how it happened. You can ask them for signs of like headache, pain, nausea, anything that could be signed with any potential, I don't know, injuries, like, I don't know, broken skull or something. You can feel for any lumps, tenderness, bleeding, any heat, pain in the head, and you can see if they are able to move around freely with like no sort of wobbling, no signs of they're going to fall over again or hurt themselves. You can help them move if needed, then allow them to move more freely if it gets better, obviously. The price again, you can protect them from using like head guard, getting rid of people, taking them away from the situation by substituting them in a game, if it happened in a game. You can rest them, so, well, obviously, resting is the best thing to do, so they minimalises any chances of redoing it. You can possibly use ice to stop swelling and lumps, and if that helps them, obviously. Compression, wear a head guard if it needs the compression, obviously, and yeah, elevation, obviously your head's up there, so you don't really need elevating. You can diagnose concussion by just looking at them, see whether they are perfectly communicating or anything like that. If not, then you know there's something wrong. You can get doctors, because of the seriousness of the injury, doctors, paramedics again if it gets to that far. During high level footballers, they'd use their doctors and get them to a hospital straight away to get them checked over to make sure everything's fine. And my last injury is abrasion, like a scratch to the surface of the knee. Superficial damage to the skin, mainly showed through grazes, scratches, bruising. An example of this is where I grazed my knee on the AstroTurf during college. I scraped it across the floor and it like took layers of skin off, and it started like oozing pus on the floor, and I had to like cover that up with a bandage. You can use salt taps on price for this again by seeing the injury and how it happened, asking them whereabouts the pain is. Obviously you can see that, you can look for signs of bleeding and swelling around the area, you can touch around for any tenderness, heat again, just to make sure it's fine, no infections are starting. Ask them to, well, if they can move. Sometimes it might be a bit painful for them, they might not be able to, so any help, progressive help that you can do by helping them move themselves, strengthening it, they can get them to the feet and they can improve their movement immediately, more or less immediately, like I was able to. Price could be used to protect from dirt and infection. Don't want any dirt getting into the wound, especially if it's a graze where it's open, you can sort of see a bit of blood inside. You can rest them to allow healing, to stop anything from getting in again. Ice to stop swelling if you put ice on it, depending on how bad it is. Bandage definitely, or plaster. And to elevate it to stop the swelling and bleeding if there is any. Might not be. And diagnosis, well, you can see the diagnosis, you can see like a blister or a scratch to the knee, graze, anything like that. Medical professions, just someone who's first aid could normally do this, but if anything happened, like infected, or if it was bad enough, and you could go to a doctor in all seriousness. And that is all 4 of my footballing injuries with examples. Thank you.